Welcome, TC Anatomy Physiology, to the last video in this for Chapter 1. Our musical guest is Khalid's Location. It was kind of tough to find a song about locations that didn't have One Direction, and I'm not a fan of One Direction. But little Khalid Location. So the reason why I picked this one is because we're going to start language anatomy and learn these directional terms and locations on the body. So anyways, I like to listen to Khalid once in a while. But anyways, so language of anatomy. How do we talk to each other? And so when we talk about language anatomy, and hopefully, again, like I said, when we're face-to-face, we'll talk about anatomical position. Anatomical position is always the basis where you start from. So when you're talking about someone being in anatomical position, body's erect, feet slightly apart, palm face forward, thumbs pointing out. So, you really can't see this on me, but if my arms are out, thumbs. And so you see all those terms there. And again, if we're face-to-face, we're going to be doing these together. If we are virtual or at remote, then I'll spend more time going over these. But so these terms are based usually in Latin or Greek, and they allow us to pinpoint specific locations on the body. So for example, on the right side, cephalic, right? Head. Cervical, you have cervical vertebrae. Dorsal means back. And so when we think about the back of the body, it's dorsal. Ventral, it's also known as the anterior posterior. So we'll spend some time on these. I just got to wait and see what school is going to be like. So there are some terms you need to know. And if you want to pause this and write it down, you can. I will move my face up here. I'm moving my face a lot, so that'll work. So superior and inferior, they go together. And superior means toward the top, inferior means towards the bottom. Ventral dorsal, which is sometimes known as anterior posterior. Anterior is towards the front, posterior is towards the back. Medial and lateral. So medial means towards the middle, and then lateral means towards the side. And again, we'll be doing a lab and some activities to reinforce this. Intermediate's in between. So I could almost say like my collarbone is intermediate between my shoulder and my sternum. Proximal, distal only refer to limbs. And so like proximal means closer to the point of attachment. So if my arm right here, this point of attachment is at the shoulder, my fingers, and I would be comparing like my fingertips to my shoulder, right? So proximal means closer, distal means farther away. So think of distance. Superficial and deep. So when you hear about superficial, sometimes you hear about people having superficial wounds. That means towards the surface or external. Often with like a superficial, if you ever had like turf burn or abrasion. Deep, think of going internal. So like a deep puncture wound. Axial and appendicular, when we refer to the skeleton, we refer to axial and appendicular subdivisions. So axial would be along like the spine, this axis. Appendicular are the appendages. And again, like I said, we're going to be reinforcing all these. Sagittal, these are different kind of planes, so how you cut the body up. So sagittal, right? Sagittal would be right. So if I cut right down the middle and I have left and right, and then you have mid-sagittal, median, and then parasagittal. Again, we'll go over these. Frontal is where you have a front and back or anterior posterior section. So think of like frontal is sometimes called coronal. So think of a crown, right? So crown or coronal, front and back. Transverse cuts you into top and bottom, or superior inferior. Sometimes called horizontal plane, and then oblique at an angle. And again, if for some reason I've got to do a little more detail because we're remote, I'll demonstrate these more with. Usually I use like an apple or a kiwi to demonstrate those, but just kind of introduction. So here's more review. You can pause these and look at these, but these are just giving you the terms, definition, and example. So I'm not going to spend a lot of time on these because I'm trying to keep these videos shorter. So again, you can pause these at any time. So regional terms, when we get to regional terms, like I said, I already talked about axial and appendicular. Axial, again, anything running along, head, neck. Appendicular, your limbs. These are your planes, again, like I said, sagittal, left and right. Median or mid-sagittal is right down the middle. And then frontal, coronal, anterior, posterior, front and back. Transverse, horizontals, and superior, inferior, and then oblique is at an angle. And so here's just some examples of these planes. And like I said, if I have to modify the PowerPoint, I will. And so transverse and median sagittal. So there's some other images you can pause this, look at it. There's plenty of videos on there. But so which plane is shown below? So if we take those kidneys, right, and we're cutting them into a left and right, there'd be a sagittal cut. That brain, we're cutting it in half, right? So you have a left and right. So thigh, this way would be transverse. Heart, cutting it in, it looks like into a top and bottom, right? Transverse. The chest, so you can see the lungs and the heart, would be a frontal / coronal. And then again, if we cut the head there so you have a left and right, that would be a sagittal. I think I did those right. I hope I did. Correct me if I didn't. So body cavities. Hopefully one of the labs will do, and I'm still figuring it out, this remote COVID lab situation, is we'll be maybe dissecting rats because I have a lot of them left over individually. And we're looking at body cavities. So dorsal body cavity, dorsal meaning towards the back, cranial cavity, vertebral cavity. So cranial cavity, there's anything that's in the brain, and then you have your vertebral or spinal cavity, right? And then your ventral body cavity is thoracic, which is your chest here, and the abdominopelvic is like your gut. And so the dorsal cavity actually has the most protection, because if you think about your skull, well, let me grab a skull real quick. So looking at part of your dorsal body cavity is you have the skull here. If I pop off the top, that's where the brain would be, and that would be completely encased in bone. Same thing here, which we don't have. We've got this opening foramen magnum, but your spinal cord would pass through that. And so your dorsal cavity offers the most protection, right? Offers the most protection for your melon. Any similarity? Maybe not. Okay, enough with that. Ventral cavity, least protection. I mean, you have some protection with your ribs and your sternum, but if you get down the abdominopelvic, there's less protection there, which we'll talk about. And so here's some images of the dorsal and the ventral cavities, and we'll label these later, hopefully face to face. Then we got some membranes. The serosa, these are membranes that line the body cavity. So there you have a parietal and visceral, and so we'll talk more about these more when we get into tissues, but a lot of these, what they do is they just provide protection. And so I'm going to move my face down here. So if you put your fist into a balloon, the outer balloon part would be like the parietal, the air would be the serous membrane or serous cavity, and then the inside would be your visceral. And so you have some fluid. You hear about people getting like water on the knee, things of that nature. There's fluid in there that lubricates the spaces between those membranes. So quadrants, so quad means 4, and so again, when we get into more detail in class, you have these quadrants. Remember, if you're looking at a patient, your left is their right, so be careful with that. So if a person is laying in bed, left, right, well, actually now it'd be on your right side, I guess, but you have these quadrants, and so the quadrants are ways that we divide up the abdominopelvic area. So you get your right upper quadrant, left upper quadrant, LUQ, RUQ, right lower, left lower, RLQ, LLQ. And so if you look, a majority of your abdominopelvic are digestive organs. So if you look in the left and right lower quadrants, large intestine, small intestine, bladder, in your upper quadrants, things like the liver, the stomach, that green thing there's the gallbladder. And it usually extends right up to about the area between the lungs and the liver there'd be the diaphragm there. And so then there's regions, which are a little more complicated. This is our last slide. So the regions, again, hopefully I'm in class to do this. If not, we'll make it work. But these regions are much more specific. And so you've got a right hypochondriac, left hypochondriac. Chondria often refers to cartilage. So hypo, below the ribs, below the cartilage. Epi, gastric, right? That's going to be above the stomach. We go right lumbar, left lumbar. If you think of your lumbar spine, right? Then you have your umbilical region, which would be your umbilical cord, and then you have the left iliac, right iliac regions, right? Because those would be your hips, which we'll talk about, and then you have your hypogastric. So again, this was just, I know this was quick, this is just an intro. Feel free to pause the video at any time. Like I said, we'll be in class. When we're in class, we'll spend a lot more time on this. If we're not in class, I will spend more time on it through videos and giving you activities. So again, I'm going to pick up with Khalid. Hopefully I'm saying that. I think I am. With location. So this is all of our first chapter. So we'll see how it goes. Hopefully I see you face to face. And this is me signing off from room 102 in the heart of Columbian. Hopefully you guys have a good day, good weekend whenever you're watching this. And yeah, Khalid, we're going to turn this up a little bit and say we'll see you. All right, have a good one.